to cervix, like I said in my first video, if you've not seen it, you can go and check it out. My first video, I talked briefly about cervix. So cervix is the neck of the uterus. Though some school of thought we like to describe it briefly inside the uterus, while some will just describe it separately. So cervix is the neck of the uterus. It measures 2.5 centimeter and it does not change during pregnancy. It just remain constant like that throughout pregnancy. During labor, if the cervix fails to dilate, maybe due to some congenital anomaly, or maybe during puberty, the woman has engaged in 1 or 2 D&C, that's the dilatation and curettage, like spontaneous frequent D&C. It can make the cervix to be incompetent, or maybe due to large cone biopsy, maybe they discover that a growth around the cervix, and they want to send the tissues for histological or cytological examination, just to rule out cancer or anything, or to know what is wrong with the cervix. So that thing can make the cervix to be incompetent. And maybe if the cervix is also incompetence during pregnancy, that the cervix just is weak to sustain the pregnancy, it can also lead to spontaneous and other threatening abortions, and that person can see obstetric and gynecologist to perform a cyclage and just to instruct and give information better. But during pregnancy, the cervix has a lot of function to perform. The cervix has this plug that is called operculum. Operculum. And that operculum, its function is that for during pregnancy, is a plug that just helps to prevent against ascending infection during pregnancy, because you don't want infection you don't want the fetus to be infected in utero. So the operculum is the one that will help to prevent against infection. And also that operculum is the one that dislodge during labor, and that's when your physician will ask you that, have you seen show? And that is a common question to all pregnant women during labor. When they fall into labor and come into the hospital, the first question is, have you seen show? Either yes or no. And if it is yes, when did you see show? Because the show is just the mucus. It's just like when you have catarrh. That's the same thing. It's a mucus. Is a mucus that is stained little with blood. So once that thing has been dislodged from the cervix, and the woman does not report to the hospital, maybe the woman continues to move about with the baby like that, it can make the baby to be prone to infection, because that is the thing blocking the cervix to prevent ascending infection, to infect the baby. So that being said, also the cervix during pregnancy, they undergoes hyperplasia and hypertrophy. Hyperplasia is just an increase in the cells and gland, and while hypertrophy is an enlargement of the gland. So and the reason why they undergo this hypertrophy and hyperplasia is just to allow for proper dilation during labor, because they are all working. Their goal is just that they are working towards labor, towards delivery, for the mother and the baby to be healthy. So now to the vagina. The work of the vagina is just that the muscle of the vagina will be worked upon during pregnancy too. Just to, the vagina is a hollow-distensible fibromuscular tube, so that it has the posterior is 10 centimeter long and the anterior is 7 centimeter wide. So, and it is a fibromuscular tube, so it is distendable. So it gives room for expansion, and you know, when something is distendable, it can expand and it can fall back to the normal place. So the vagina is just, the vagina will be worked up by the muscles, by the hormones of pregnancy, the progesterone, estrogen, the hormones of placenta and everything, just to make sure that the place is intact. And also the edge of the vagina is acidic, and the walls of the vagina, they are pink. So anybody that see alteration in the walls of their vagina, maybe they notice that it's just white, it's very, very whitish, the person just to see a obstetric and gynecologist or the midwife that is managing the person, depending on the part of the country that you are watching from. So the person is to see for proper diagnosis and proper treatment, because the wall is supposed to be pink. And the lactobacilli, that is the normal flora for the vagina. So the lactobacilli, they are the one that keep the vagina to be acidic in nature, because the pH of the vagina is 4.5. It is very, very acidic in nature. That is why no bacteria can withstand that 4.5. It is strongly acidic, and it kills off any bacteria that want to stay there. So that is why I will place this as an advice for any woman that is fond of using soap, antiseptic soap, medicated soap, to wash their vagina, or spray perfume in their vagina in the name of, oh, it's smelling. No, it doesn't require anything more than water. Just use your water to wash it off, just water, and that's it. No need of. If you are doing that, you are just killing off the lactobacilli that's supposed to stay there. That's the normal flora that's supposed to stay there and help and assist in killing, or it's just like your normal white blood cell. They are just like the soldiers in the vagina that helps to kill infection. Then moving on to breast, it is in rudimentary form. And breast, each is located on the chest wall with the sternum in between, and it has 20 sebaceous glands. It consists of the areola and the nipple. And areola is that round pigmented area before the nipple, that is the areola. One of the function is that it's for cosmetic purpose, and also it also help to nourish the newborn, because during pregnancy milk will be produced and the acinine cells will be increased, so that to aid increase in the production of milk, and it will be stored in the ampulla. That is where the ampulla is just like a temporary reservoir that is underneath the areola. That is why in my next video I'm going to talk about the positioning about breastfeeding. I'm going to talk about proper attachment and positioning of baby during breastfeeding. So areola is the ampulla is under the areola, and there's a way the baby is supposed to latch on the breast just for the milk to be expelled out. And also changes during pregnancy. Breast is one of the accessory organs that is one of the earliest signs that make woman to know that, oh, I am pregnant. Is one of the earliest signs to know, and this is the due to estrogen and progesterone that is produced from the luteum, that is the yellow body, pending the time that the placenta hormone will be ready. So I'll be talking about the stages, the changes that occur in the breast in stages, in the chronological stages. And 3 to 4 weeks, there is this tingling and prickling sensation of the breast, and this is due to the increase in blood flow, increase in blood supply to the breast at that time, and also due to estrogen and progesterone that is also still present in the blood vessel. And also the breast is tender to touch and painful. 6 to 8 weeks, there is painful and tender sensation. The breast is just painful and tender to touch, just like ovulation time, but it's just that this time around is a little bit more than ovulation. And there's this bluish surface vein that appears underneath the skin of the breast. I think this can be prominent in more prominent in fair skin ladies. They can easily view that too. And around 8 to 12 weeks, there is sebaceous gland is, sebaceous gland is 20. There is 20 sebaceous gland in the breast. So the sebaceous gland will produce sebum. This sebum is an oily substance that helps to nourish, and it is secreted to nourish and make this nipple soft in preparation for delivery. Also, the pigmented area surrounding the areola, the areola comes before the nipple. So the pigmented area surrounded by the areola becomes more darkened, especially in dark ladies. It becomes more darkened. While at 16 weeks, the colostrum is present and it can be expressed at 16 weeks. While in late pregnancy, the colostrum can leak out. Even if you do not express it, can leak out on its own. And that made me want to talk about colostrum, just little about colostrum, because I noticed that though cultural aspect, cultural belief, traditions can never be removed from African setting. I think that in some tribe, it is forbidden for the woman, for the mother, to give their baby colostrum. Though I don't know the tribe, but if you know anything about the tribe and reason why the colostrum cannot be given, please, you can put it in the comment section. We learn every day, just like I say, I can learn from you too. So, but colostrum medically, it has a lot of function. It has a lot of function, and it's very, very vital to the baby. The baby needs it. After taking vaccine, and the first vaccine, the VCG, the OPV0, the HPV, from the hospital to prevent hepatitis, against hepatitis, against polio, and the likes. This colostrum too is still good to give the baby. It is a deep yellowish or creamy fluid that is thicker than mature. Breast is also mammary gland, in case somebody just ask you. It's also mammary gland. So back to colostrum. It's the composition of colostrum. It contains protein, fat soluble, vitamins, minerals, immunoglobulins. These immunoglobulins, they're antibodies. We have immunoglobulin A, immunoglobulin G and M in this colostrum. So people that are expressing it, I'm not saying they should start giving their baby if their traditions forbid it, but I'm just trying to say a lot is being wasted if the colostrum is just being expressed away and not giving it to the baby. And also, it also has this laxative agents in it that helps the baby to clear off the bowels, to clear off the bowel of meconium. And meconium is this greenish stool that the baby pass within the first 24 to 48 hours of birth. I hope you've gained one or two things from this session, though it's a little bit lengthy, but please take out your time to listen to it. And please don't forget to like, comment, share, subscribe. Thank you very much. Bye.